Now let us do an imaginary diagnosis. So let's suppose this is a patient and her name is Pushpa. So Pushpa will come to you and she'll tell you the chief complaint, that why she has approached you. So she will tell you that she has sudden, usually unilateral. She won't say unilateral, by the way. She will say that she has pain on one side of the face. So she'll say that she has sudden, unilateral, severe, brief, stabbing, lancinating pain in around the area. It could be here, or it could be here, or it could be here, based on the 3 division of the trigeminal nerve, V1, V2, V3. Okay. Then to know more, you will take the history of the patient. You will take history of Pushpa. So Pushpa will tell you about her condition in more detail, and by all the history you took, you will come to a conclusion that it could be trigeminal neuralgia. Alright? But if it is not pointing towards trigeminal neuralgia, it means that you have to consider other diagnosis. That is out of scope of this video, so we'll not talk about it right now. So let's suppose all the case history points towards TN. Then we'll go for imaging studies. Okay, like we'll do MRI or CT scan. Okay, and we'll see if there is any lesion or not. So if the imaging studies are normal, that means it is classical TN. Classical TN means it's idiopathic TN. But if the imaging studies are not normal, that means it is symptomatic TN. Symptomatic TN. Now, if it is symptomatic TN, what you'll do, you will consult the neurosurgeon. You'll consult neurosurgeon because it requires surgical treatment. So this kind of symptomatic TN, obviously if you have tumor, aneurysm and any other lesion, you require surgical treatment. So that is a different thing. Now let's suppose Pushpa has classical TN. So what you're gonna do, you will give her AED, that is anti-epileptic drugs. So you'll try that. And we studied that we give carbamazepine to check whether our diagnosis is correct or not. It is a diagnostic indicator as well as it is also used for the treatment of the trigeminal neuralgia because the patient will respond to it. The pain will be relieved. So when you give AED, there could be 2 possibilities. Either the pain will be relieved, yes, or you won't get pain relief. Pushpa won't get pain relief. So if Pushpa doesn't get pain relief, what you do, you add second AED. Okay, and then again you check if there is pain relief. If again there is no pain relief, then you have to reconsider your diagnosis. You have to think that does the patient truly fit the criteria or not. And if Pushpa fits the criteria, then you will go for surgical treatment because you are over with medicines now. Then you will go to surgical treatment. And here we saw that if Pushpa is responding to the first AED that we gave her, then what we do, we maintain this medication. Okay. So this diagnostic algorithm that we studied, this was given by Shrivani Matthews. So these 2 people, they gave the diagnostic algorithm for the trigeminal neuralgia. Now before I end this video, let us see how we use local anesthetic agent for diagnosis of TN. So we are seeing how we use LA for diagnosis of TN. So we need some syringes, and to be precise 3-1 cc blah blah, and we need needles, that is 325, and we need sterile normal saline. You must be wondering why we need sterile normal saline. We'll see why. And we need 2% lignocaine without adrenaline. We need 2% lignocaine. That would be without adrenaline. And we need several alcohol wipes. Alcohol wipes. So let's see how we proceed. So let's see the procedure. So what we do, we begin at the surface site of the pain and then move proximally. So again we'll call Pushpa, and what we'll do, we'll give injection at the surface site. For example, if the pain is in her lower lip, we'll inject first here. Then if the pain is not relieved, we'll give injection in the mental nerve. And then if the pain is not relieved yet, we'll give in the inferior alveolar nerve. So we are proceeding from the surface and we move proximally. Alright? So before giving the LA, you should give 0.5 cc of normal saline. So I would say start with normal saline because we have to check if Pushpa is psychologically normal. So we have to check for psychogenic pain. If Pushpa is really having pain or Pushpa is having psychogenic pain. Okay, so if you inject normal saline here and Pushpa says that I'm fine now, it means that it was psychogenic pain. But if the pain persists, it means that Pushpa really has some serious pain. Okay, take her seriously. Now what we do, after 0.5 cc normal saline, we inject 0.5 ml of 2% lignocaine. Lignocaine without adrenaline at the surface site and wait for 5 minutes. So if the pain is relieved, then you have to give direct therapy at the small nociceptor fibers. But if the pain persists even after you give the injection here on the local site, then you will inject little deeper. Go deeper and wait for 5 minutes again. 5 minutes again. If the pain is relieved, then it means it was musculoskeletal origin. The pain was of musculoskeletal origin. Now if the pain is not relieved, you inject at more proximal position of the nerve. And now if the pain is relieved, then you give direct therapy at the site. So what we can do, we can give selective inferior alveolar, lingual, buccal, infraorbital, PSA. So all these blocks could be given one by one to know the involvement of the branch of trigeminal nerve. So we can block them. For example, if you block the lingual and the patient does not have pain now, it means that lingual nerve was involved. And if the pain persists, it means lingual was not involved. Then we'll move on to another nerve. So this is how we use the local anesthetic as the diagnostic agent. So this was the end of the video. I hope you found this video helpful. Don't forget to comment, like. Thanks for watching. Allah Hafiz. And yeah, in the next video, we'll be studying about the treatment of TN. So stay tuned. Bye.